Hello, my name is Jim Burlew. I've been a resident of Oceanside since 2005, and I'm running for the Tri-City Healthcare District Board of Directors. I hold an MBA in Healthcare Management. I'm a California Certified Hospital Inspector, and I'm a Healthcare Compliance Specialist. In April, I had to visit the emergency department of Tri-City with acute appendicitis. During this visit, I spent approximately 12 hours on the floor of the emergency department. I never received any pain medication, was never brought to a bed, never saw a doctor. I was in so much pain that I could not sit up, I could not stand up, so I ended up laying on the floor of the emergency department waiting room. I was in the corner. After a period of time, I had a nurse come over and a security guard, and both of them tell me to get off the floor. It was not safe. I told them I needed help. I needed a lot of help. And they said, "You have to get off the floor." They wouldn't stop telling me to get off the floor until I crawled to a chair and put my head on the chair. Then that was good enough, and they left me alone. But I still received no help. Typically, when you go to an emergency department, you should be in a bed within 30 to 45 minutes. I went to Scripps Encinitas after this, and they took out my appendix. I was in a bed within 5 minutes at Scripps Encinitas. This is a far stretch from the 12 hours that I spent laying on the floor at Tri-City Medical Center. During my time in the emergency department at Tri-City Medical Center, I saw the elderly there. I saw the infants there, the toddlers. I have 2 young boys that are 2 years old. And I have my parents and in-laws who are elderly. I could not see them going to Tri-City Medical Center for any sort of service if they were to receive that. The toddlers were actually turned away because they didn't have the staff to take care of them. And a lot of the patients that were in the emergency department were there just as long as I was, if not longer. Tri-City's leapfrog quality scores used to be an A. They used to be the highest. Now they're down to a C. And in fact, we have one of the lowest measures in the United States. We have set the bottom of the bar. Our CMS scores for Center for Medicare and Medicaid Services are the lowest in the county. And according to U.S. News and World Report, when it comes to heart, cancer, hip or knee replacement, as compared to Palomar or Scripps Encinitas, they are average to high performing. Tri-City is average to below average. So we have a lot of work to do. I promise to bring fiscal stability and responsibility by implementing process controls and efficiencies and performing a forensic audit to find out where all the money has gone. We can optimize operations as well. Currently, more than 50% of the people in Carlsbad, Oceanside, and Vista go to other hospitals rather than Tri-City. 4 years ago, the emergency department visits were 70,000 patients a year. 2 weeks ago, the CEO told us that they were down to 60,000. There's a lot of work to do. I will reinstate joint ventures with the Vista Community Clinic and UCSD and any other local organization that will be a benefit to our community. I will perform a facility master plan, include the community, doctors, nurses, and support staff in all the strategic planning versus what we have now, which is just a plan to build a tower that is too big and too expensive. I will reopen the behavioral health center that the board is closing on October 2nd, as the behavioral health center patients will now go to the emergency department and make the emergency department wait times even longer. I will stop the outrageous attorney fees and lawsuits, and will open the campus medical office building, which has not been open for 5 years since litigation. Litigation which was initiated by Tri-City. This has incurred a cost of $5 million or more annually. I'm committed to serve with integrity and accountability. I appreciate your support, and thank you for your vote. Semper Fi.